Let's talk about the hip joint, how it works, and why you may be getting pain in the hip. Hip joint is one of the most stable joints in your body. It has three major factors that give it stability. It is a ball and socket joint. The head of the femur fits deep in the socket of the pelvis. On the surface of the joint, there is a labrum or cartilage that creates support and protection inside the joint. Now, because we don't want these two bones rubbing against each other, that'll lead to arthritis. We want to make sure that the surrounding muscles in the hip joint prevents that. Your glutes, hip flexors, and adductors provide stability for the hip. So why is stability so important? Every time you move your leg, whether it is getting in and out of the car or walking up and down the stairs, you will need that ball to stay in the socket. For example, when getting in the car, you will need the ball to stay in the socket as you lift your leg to get in the car. You'll need the muscles to be able to lift the leg and the ligaments to hold it in place. Most commonly, what we see is the culprit of hip problems is that there's a weakness of certain muscles, and typically it is weakness of your glute muscles. They are usually a combination of them being too tight and weak. This will cause a shift in the balance of the ball and socket joint, and this imbalance may lead to arthritis in the joint. The key component to treatment will be a combination of exercise to strengthen the weak muscles and to stretch and move the hip structures. This will improve the coordination of the muscles surrounding the joint and improve the function to help with the ability to perform day-to-day activities like walking up and down the stairs and getting in and out of the car. Why I'm sharing this with you today is because we know that better hip movement matters.